Next question, will ATX-101 be a viable alternative for submental fat reduction? Where are you going to start? Start with that table.
I think absolutely yes. This will bring patients into the practice who weren't there before. It's going to bring patients who are too old for this, who are going to get facelifts. I can't wait to try it on me. I think it's going to be good to try also for some lipo deformities and things. So I'm excited to get it. So what ATX-101 is it's called Kybella. So Kythera is a publicly traded company, market cap's over $1 billion now. What they did a number of years ago was they looked into mesotherapy techniques, and they looked at the products, and they thought, well, is it deoxycholate or the phosphatidylcholine? They found out after a couple of $100 million of studies that it was the deoxycholate and not the phosphatidylcholine. So they finally got FDA approval for submental fat reduction with this. Probably the cleanest studies I've seen with anything, like super good studies with MRIs and everything, and got approved in early May. It's multiple injections into your neck, usually between 3 and 6 sessions, about a month apart. So you start to hear a lot of the stuff over the next couple of months with this.
I'm very excited to get this because I think it's going to drive people in the door. But after I discuss the morbidity of those injections and the timing of it, and then I tell them that in 30 minutes I can do submental lipo in my office using local anesthetic, and they'll wear a sling overnight and can go to work the next day. I don't know how I'll ever sell it very much, but I think it's great from a marketing perspective.
But there are still a lot of patients that don't want to have surgery.
Yeah.
And Jason's right. What this will do, a lot like Botox did in the the early 90s for many of us, was drove patients in asking for a treatment. And I think it's right. There's some people that will choose not to do it. In the studies, we did 300 treatments. There were less than 10% of patients that had significant swelling, although those patients that did have significant swelling, they looked like a bullfrog. I mean, it was not go out sort of thing. With that said, the protocol didn't allow for any kind of compression garments to be used, and I think that would really change the game and probably will become a standard part of the therapy when you're getting the injection. So you get a whole series like Jason described. It's like a grid that you put on the person's neck, and you'll hit every area. But I think the more exciting thing he alluded to also is that the applications to something that you can inject and destroy fat with are, I think, are going to be, the neck is going to be minuscule. There's a lot of questions on here. Cellulite might be another answer. So there's a lot of things that this will have applications for that we don't even know about with innovators using it.
Wait, how long did the swelling last on the bullfrogs?
About a week. About a week of swelling, and like I said, unfortunately, we weren't allowed to use compression. But if somebody came in your office after surgery and had that, you'd definitely put a compression dressing on them.
Because the slide deck from the company also showed that in the patients who've had a series of injections, most of the swelling was after the first injection.
That's right.
And that the secondary injections had less swelling.
That's absolutely right. So the first injection was the time when they had the most dramatic, and subsequent injections were much less. So there's obviously an inflammatory response to this, which I think is part of the reason, like we were talking about earlier, that it helps. Probably the same thing with cool sculpting. We're killing fat cells. There's lipids that are released into the tissues that are inflammatory in and of themselves, and that inflammatory response causes the skin to contract.
And with that, you definitely saw some skin tightening, didn't you?
Yeah, absolutely. There was no question it was more than just fat removal. It wasn't just hanging skin when we were done.
Okay, guys. Barry, why don't you address the body contouring procedures with something similar?
Well, I think if you're using it for the neck, it'll do work in the body, but I think we need to really know the cost of this stuff, because you're obviously going to use more in the body. Will the cost allow the doctor to have a decent profit and a decent ROI, or is the company going to be making most of the profit here? That's what I'm waiting to see. If it's a low cost, then you can entertain body procedures. But if it's a minimal profit and a high cost, you'll probably need to use a gallon of it for the body. So I don't know if that would be viable.